Back children, now we'll see what is cardiac cycle. Now what is cardiac cycle or one cardiac cycle, which is equal to one contraction and relaxation of the auricle and one contraction and relaxation of the ventricle, which is auricular systole and diastole plus ventricular systole and diastole together makes one cardiac cycle, or which is equal to one heartbeat. And you know how many times the heart beats in a minute for a normal person, a normal average adult? Yes, 72 times. Okay. Now during each cardiac cycle, what are the events that happen inside the heart? We will see now. Okay. Now suppose the heart is in a joint diastole. Diastole is the relaxation phase. Systole is the contraction phase and diastole is the relaxation phase. Okay. So suppose there is a joint diastole, which means all the heart chambers are in a relaxed state. It may happen the heart doesn't have such a diastole, okay, joint diastole, but it may happen in one in a millionth of a second. That much time it may happen. And now let the first heartbeat start from the SAN, suppose. Okay, so when it is in a joint diastole, all the heart chambers are in a relaxed state. And what about the valves, the tricuspid and bicuspid? It will be in open position, right? It will be in open position, and the blood flows passively. Little bit of blood flows through the valves into the ventricles. Okay. Now, when the very first heartbeat starts from the SAN, very first contraction starts from the SAN, sinuatal node. So SAN generates an action potential and it will reach the AVN, auriculoventricular node. From the SAN, it will reach the contraction reaches the AVN through the muscle fibers, right? By the time this will cause the contraction of the auricles or the atrium. Both the auricles start contracting. Okay, right? And when this auricles contract, what happens to the blood inside this one in the auricle? It is squeezed into the ventricles from its respective auricles. Okay, now the valves, both the valves are open now. Okay, now when the auricles relax, immediately the heart, after a contraction there is a relaxation, right? Now immediately the auricle starts relaxing. Meanwhile, what happens to the SAN, the action potential generated from the SAN? It will reach the ventricle through the bundle of Hess, through the Purkinje fibers. It goes throughout the ventricle, and now the ventricle starts contracting, or what happened? The systole of the ventricle happened. Now what will happen now? From where now the blood inside the ventricles, when the ventricles contract, where will the blood go now? No, it has nowhere. Now immediately after the blood from the auricles goes into the ventricle, immediately when it relaxes, the auricle relax, the valve, the bicuspid and the tricuspid valve shut close. They shut close, and this is the very first sound you hear, which is the lub sound. Lub sound, right? Right. Okay. Now, when the ventricles contract, now the valves are closed from the ventricle. When the ventricles contract, from the ventricle, from where the blood will go now? It has to go into the pulmonary artery from the right ventricle and into the aorta from the left ventricle. Okay. And now the semilunar valves gets opened. Okay. Immediately after the semilunar valves, when the blood passes to the semilunar valves, immediately by the time what happens, the ventricle starts relaxing. It comes to the normal size. Meanwhile, another second contraction has started and the auricle has started to contract. Now, when the ventricles relax, the blood will return back into the ventricles from the through the semilunar valves, right? So now the semilunar valves shut close so that the blood is not flowing back into the ventricles. Clear? Now this closing of the semilunar valves of the pulmonary artery and the aorta results in the second sound, the dub sound. When is the first sound heard, children? When the bicuspid and tricuspid valve shut close. They shut close together, right? That's the very first sound. Okay, right. The second sound is dub sound is heard when the semilunar valves close, when the ventricles relax and the blood will not flow back into the ventricle, right? Okay. So after the first cardiac cycle, another cycle starts, a second cycle starts, okay, and again the auricle and ventricle starts contracting and relaxing. Now a cardiac cycle, this is called one cardiac cycle, children. Okay, so a cardiac cycle is completed in 0.8 seconds, 0.8 seconds, and one heartbeat is what is one cardiac cycle, right? And how many times you said a normal average person's heartbeat during 1 minute? 72 times per minute. So almost 70 ml of blood is pumped during each cardiac cycle from the heart or by the heart. And that is called as the stroke volume. So what is stroke volume? The amount of blood pumped out from the heart during one cardiac cycle is the stroke volume. And the stroke volume into 72 times gives in a one minute how much of blood is pumped out from your heart, okay, which is what is called as cardiac output. The stroke volume into 72 times, which gives you cardiac output. Okay. Now next is about, you can actually measure the number of times our heart beats by using a ECG, electrocardiogram, which is an instrument used to obtain, or it can be again drawn on a graph, which is called as electrocardiograph. ECG is a machine used to obtain electrocardiograph, okay, or cardiogram also it is called. So to test or to obtain this ECG, what you should do, what is a patient is done, he is fitted with normal for a routine checkup. For a routine checkup, he is fitted with nearly 3 electrodes. 1 in his chest, 2 in his 3 or 4, okay, 2 in his wrist, near the wrist it is fitted, and by a means of a gel like substance. 3 electrodes are fitted with the help of a gel like substance which acts as a conductor, which conducts the heart through to the machine. The gel conducts the heartbeat to the machine now. Okay, now 1 to each wrist and 1 to left ankle also. 1 to left ankle, 2 again in one in the chest region and 1 in the wrist region. Like that 3 electrodes are fitted, and when this machine works, you might have seen this, how the graph grows. Okay, it just takes how the graph goes, it's this way. Okay, now it has a small wave like this. How many times you can see the waves for 1 minute? 72, like this graphs, this upward curve. you can see on this graph, right? Okay, now it has got this is one ECG, each one is called as the, this one heartbeat. This represents one heartbeat. This one heartbeat. Okay, it consists of a small P wave and a small depression down, which is called as Q. A small P and a just depression, then goes up very steeply it goes, which is, this one is called as the P wave. This is the QRS, and this one goes again, and next second contraction begins. Now again, the starting of the first contraction is called as the T wave. Okay, so we can call it as PQRS T wave. Each heartbeat consists of a, what is the wave called? P wave, PQRS and T wave. Okay, right. P represents the auricular contraction. See, which is very short and which is of short duration. See that this peak is represents the QRS represents the ventricular systole. What is this one now? So this is auricular contraction, and this depression down is the auricular relaxation. It relaxes very quietly, it relaxes, and immediately followed by a ventricular contraction, and this T represents the ventricular relaxation. Okay, so like this, how many waves you can find on a ECG? Nearly 72 times, and it depends. This is for a normal person, it is 72 times, and depends for when you do a strenuous exercise and all, it may vary. If there is any problem with the heart rhythm, then this rate may vary. Okay, this ECG is very useful or helpful in detecting the problems of the heart. Okay. Now, first we have discussed what is double circulation. Now we'll be doing in detail what is double circulation. In the case of vertebrates, in the case of birds and mammals, we have double circulation, complete double circulation, which is, the heart, the right atrium receives deoxygenated blood. Okay, now from that it goes to the right ventricle. From there it is carried by pulmonary artery to the lungs, which is called as pulmonary circulation. This type of circulation is called as pulmonary circulation. And the other side, the left auricle receives oxygenated blood. Oxygenated blood. The left auricle receives oxygenated blood, and which comes down into the ventricle. Oxygenated blood. From there it is supplied by a main artery called as aorta to all the other parts of the body, which is called as this circulation is called as systemic circulation. So the one way of circulation through which the supply is going to the lungs to get oxygenated is called as pulmonary circulation. And from the left ventricle, the pure blood is transported to all parts of the body, which is called as systemic circulation. And there is two more circulation route, which is called as the coronary circulation or circulatory system. See, the heart is again one organ. Heart is the main organ which pumps blood to all the other organ, and it will pump to its own. It has got a circulation route which is called as coronary system or circulatory system. Coronary artery as well as coronary veins you have there. Okay, so the main two types of circulation is pulmonary circulation and systemic. There is third type circulation called as coronary circulation, which is a vessel from the heart supplies to the heart itself. Okay, and there is one more type of circulation which is called as the portal circulation. What is that? Portal. Okay, that is one vessel from the heart goes to the intestine. Why intestine? Intestine is the place where the nutrients are getting absorbed, and it goes to the, there are 2 or 3 portal circulation in our body, children. You will be learning in a higher class, maybe not in detail in this class. Okay, so from the intestine, goes to the intestine and carries the nutrients and goes to the liver. Liver is the biggest factory. It needs so much of nutrients, so much of oxygen, and so many other things has to be supplied. Okay, so it carries the blood from the heart to the intestine, and from the intestine it goes to the liver, or it goes to some other organ, like that. So this route is called as portal circulation. Okay, children.